Hey YouTube, it's Marida and welcome to another edition of the Nurse Lounge. And in this edition, we are going to talk about something that people keep asking me, and I want to clarify for people who may be interested in this route. So I have been asked the question, which is better? Now I've already have a video, which is better, DNP versus PhD type of thing. They want to know which is better, DNP in nursing education or PhD in nursing education. They want to know which one is more valued. They want to know which one can I do things besides being an educator, which I don't know why you want to have a one nursing education if you wanted to not be in education, but neither here nor there. Anyway, they want to know, how do I get to be a nurse educator? What do I do? What steps do I take to be a nurse educator? So if you want to know, if you happen to be interested in being a nurse educator, just like me, then stay tuned. Dr. Marida P. I am a registered nurse. I've been a nurse for 16 years. I'm an OB/GYN, well baby nurse. I'm a nurse educator. I'm an associate professor. I teach at an HBCU. And let's see what else. I am doctorally prepared. So yeah, we have it there. I have a DNP, a Doctor of Nursing Practice. So PhD, people have asked me, they want to go into education. They want to know what's the best route to get here. How do I go about being a nurse educator? How do I go about, how did you get to where you are, Dr. Marida P? That's what they want to know. How did I get here? And so if you want to know how I got here, I'm about to tell you the steps of how I got here, in addition to some tips, and go ahead and talk about certifications and talk about the PhD in nurse education versus the DNP. And I will try to link my PhD DNP video, which is a general video, to this one. It's an old video, but in case you're looking for it, it does say PhD versus DNP, which is better. And so it's probably about over a year and a half old now. So I will try to link that video to this one, but if not, that is what it is. So I want to go ahead and now focus on education. So I'm going to kind of go back and backtrack a little bit about what the difference is between a PhD and a DNP in general. And then we're going to talk about nursing education specifically, and then I will talk about the other stuff. So when it comes specifically to the PhD, I want you to understand that PhD means a doctor of philosophy, and it means you are more research focused. That means you're the one who is doing the research on things. You're the one, you spend your time in research. That's pretty much what you do. When it comes to the PhD in general, it's research based. If I could say those two words, that's all you need to know is research based. DNP is Doctor of Nursing Practice, which is clinical based, clinical practice based, shall I say. Those are two different things. Now, I'm not going to say which is better because it depends on what you really are into. It really depends what you're into. I am not a research person. I don't care nothing about no research. I mean, okay, that didn't come out right. I don't really care for research in terms of going to do it. Now, in the DNP programs, we did research, but it's not as extensive as those who are in the PhD program. And people say, well, which one's going to get you the better job? You can get hired with all of them. You can get hired with the EDD, which is Doctor of Education. You can get hired with a DNP, which is a Doctor of Nursing Practice. You can get hired with a PhD, which is a Doctor of Philosophy. You know, and if that school is only looking for a PhD, they will say in their search that they're looking for a PhD prepared nurse. It will say that. If they're looking for a DNP nurse, they will say they're looking for a DNP nurse. If they don't care, they will say they're looking for a doctorally prepared nurse. So you have to go to where the job is. And so I don't really want to get into, you know, well, the PhD is better because it'll make you more marketable. No, I know people who got jobs in every area of nursing, from academia, because they'll say, well, academia, you need a PhD. Nope, you can have a PD, you can have you can have an EDD, and you can have a DNP in academia. I know, again, nurses who have all of, not one nurse who has all of them, but different nurses who have all the different doctoral prepared degrees, and they all have jobs in academia. So that part just depends on the situation. This is no different than a hospital saying they want baccalaureate prepared nurses compared to associate prepared nurses. Well, if you go to a hospital who only wants a baccalaureate prepared and you only have an associate's degree, well, you don't apply there. Just that simple. And if you want to have that as an option, then you go get your bachelor's degree. So it just depends on where you want to go. Okay. I don't do research. I'm not really a fan of research, extensive research. So therefore I went the DNP route, Doctor of Nursing Practice route. Very proud of that. I have no issues with that. That's kind of what I want to do. Now, we got that part done. Let's talk about nursing education specifically. You have to have a master's degree to get a doctoral degree. I've said this time and time again. People think they can go from this to doctoral degree. You have to have a master's degree first. My master's degree happens to be in nursing education. So for me, it was a straight shot. It was just easy because my master's is in nursing education. But you can be an FNP, a family nurse practitioner. You can be any kind of NP and actually go into education if that's what you choose to do. Because a lot of times your FNPs teach the FNP classes because they're FNPs. Or your nurse practitioners teach the nurse practitioners is what I'm trying to say. So you could definitely do that with your master's being as a nurse practitioner and definitely go into academia with that after you get your doctorate degree. Depends on what level you're teaching. Now, when it comes to the education part, I've had people say, well, how do I need to do this? Do I have to take a certain certification to be a nurse educator? No, we don't take certifications to be nurse. We're not to teach at the doctoral level. You don't have to have a license for that besides your nursing license. I have my RN license and that's all I need to do my job. Now, when you are a provider, when you are a nurse practitioner, you have to have a license to practice. I don't have a license to teach per se besides my nursing license. I have to be an RN and I have to have the certain level of education I have to have. Now, let's say, for instance, you wanted to teach at the baccalaureate level. If you want to teach at the baccalaureate level, you have to have usually a master's and or a doctoral degree. If you are going to teach at a university or college, most of them want you to be doctorally prepared or at least have started the program. Even if you have not finished it, have started the program. Every institution is different, so you need to go find that out for your institution. But most universities are wanting you to be doctorally prepared to teach their students. That's what they want. They want experts in the field. And being doctorally prepared, whether it be PhD or via DNP or even EDD, means you're an expert in your field. That's what doctorally prepared means. That you are an expert in your level of education in your field. I am a nursing expert. I do academia and also I'm an OB nurse. So I know OB, I know GYN, I know nursery, and I know how to teach college students. Me personally, I have taught the LPN student. I've taught the LPN to RN students, so it's a bridge program. I've taught the 2-year student, the ADN, and I've taught the 4-year, the BSN student. So I've taught across different levels of education, and that's just what I've done because I've learned how to do that. Now, my segue, so if you want to know how do I even get into education even though I don't have the master's degree yet or I don't have the doctoral degree yet. If you want to come into education, the one thing I suggest you do is go somewhere and be a clinical instructor. Be an adjunct clinical instructor somewhere. So if you are currently baccalaureate prepared, you can be a clinical instructor for LPNs. So go apply to an LPN program. And that way you could definitely see if this is something that you want to do. LPNs typically go to clinics and or LTCs, long-term care facilities. So if you want to do this kind of job, you need to go ahead and go to that kind of facility. You need to kind of go to a facility in which you can teach, LPN students. So they'll go to, like I said, an LTC or a clinic of some sort. And typically that's what you can teach at that level. So with a master's degree, you can teach baccalaureate prepared students, you could teach ADN students, and you can teach LPNs, of course, CNAs as well. So you can teach all those at a master's level in clinical. Or you have to be in your clinical rotation. You have to already, not clinical rotation, you have to be in your master's program to teach. So every school is different. Some of them want you to be master prepared already, or some of them are okay with you have already started your master's program, but yet you're not finished yet, but you can teach the clinical component. I always say, if you think you want to get into education and you've never done it before, clinicals is a great way to try it before you buy it. There's a lot of politics in academia, a lot of reports, a lot of politics, a lot of issues in academia that you wouldn't want to jump necessarily into until you know, is this something you want to do? Can you handle the nursing student? Can you handle the student who is disgruntled? Can you handle this, if you happen to be a minority, can you handle the student who does not want to deal with you because you are African American or you're ethnic minority? Can you deal with the student who is entitled? Can you deal with a student who really has to be babied to a certain degree? Can you handle the student who still relies on their mom and dad to speak for them, which I don't tolerate that. If you're 18, 19 years old, you've been declared by law as an adult. So due to FERPA, you can't have your parent call me anyway. Another story, another day. Anyway, with that being said, can you handle those things? Can you handle the fact that in academia most of us are female, so in nursing we're all female mostly, so can you handle that? So again, clinicals is a great way to see if you can try it before you buy it. So go to see if you can teach somewhere in clinicals. If that doesn't work for you, sometimes it's who you know, not what you know. I have gotten majority of my jobs not because of the fact that I applied for them. I got my jobs because I came recommended. Meaning this. People say, hey, we're looking for somebody who does OB. They're like, oh, I know somebody. So then they will give them my information. And then next thing you know, they'll call me. And I'm like, oh, okay, well, what is the pay? What is this? What is that? What my criteria is? What I have to do? And I'm like, okay, yeah, I'll do it. Type of thing. So I've got majority of my jobs because of who knew me and my expertise in OB. Even for my job, at the job that I have right this minute, I did not get the job because I applied for it after the fact. I applied for it because that's a formality of getting a job, is to apply. But it's not where I saw, oh, they're hiring, let me go get a job. They already wanted me before I even finished my programs. So, and plus I have 15 years of clinical experience. So I've been doing clinicals for 15 years, teaching nursing students at those different levels. So I have the clinical expertise. And so therefore, if you have the clinical expertise, if you know what goes on outside the world, it's not that hard to learn how to teach the material. You get you a textbook that they're reading. You basically learn, basically pull out what needs to be taught to them and convey it in a way and bring your real life examples of how this works. So I always have story times for my students. Like, let me tell you what happened when I did this or what happened when I did that. I always have a story time for my students. So with that being said, that's kind of how you get into it. You need to make sure that this is something that you really want to do. You need to make sure that you have your master's degree in education or in some type of nurse practitioner. Then again, if you want to teach at higher levels, you have to have your doctoral degree at most institutions, and you pick which one you want. So if you want a PhD in education, get you a PhD in education. If you want a DNP in education, get you a DNP in education. My DNP is in neither. My DNP is not in education. My DNP is in executive leadership. So again, I have a DNP that's not technically related to education, but I still have a job in education because my master's is in education and I can teach with a DNP, period. So you can do all those things. Certifications. Again, there's no certifications that you have to go teach, but there are certifications to be obtained, meaning that there is a clinical nurse educator certification. There is a nurse educator certification. So these are the things that I'm actually going to be working on next. But those are not required for you to start teaching. Those are something that you get after the fact, or you get before the fact. Either way, it's not like when you are be board certified as a nurse practitioner or FNP or whatever that is. You don't have to have anything. There's no certification like that. There's no license that you have, shall I say, to become a nurse educator. You just have your nursing license, your RN license that you have to have. Or if you already happen to be a practitioner, you would have to have your nursing license, of course, your practitioner license as well to prove that. But there's no license to be an educator. That's what I'm trying to say. The certifications can come after the fact. So that's that question. And then when they had one more question, I want to say, that's it. I think that's it, actually. I think that's all they wanted to know. How do you go about navigating all that? To recap, a PhD is research, a DNP, more clinical focus. In nursing education, you can get either one of them. Can you get a job in either one? Yes, you can get a job with either one. However, if they only want a PhD, you go where the PhD people are. If they only want DNP, you want a DNP. Now, I will say this. There are some jobs I have seen that says they want a nurse who is doctorally prepared in nursing, which is the DNP. So if they say they want, because PhD goes across all kinds of disciplines. You get a PhD in anything, but you can't get a DNP because it's Doctor of Nursing Practice. It's specific to nursing. So be mindful of that as well. PhD, you can get in nursing. You can get a PhD in history. You can get a PhD in all this other stuff, but you cannot get a DNP in anything other than nursing. So if they say they want someone who has a nursing focused doctoral degree, they're talking about the DNP typically. So be mindful of that. So hopefully that answers her questions, or whoever's question regarding getting into the education realm, the PhD in education, the DNP in education. There's no license to be a nurse educator specifically, but you have to have your nursing license, but there's no other license outside of that. Certifications you can get after the fact or before the fact, but that's not tied to a license. It's just an add-on. And then you go teach. And so that's the best way to do it. Now, I will say this. Because most programs want someone to come with experience to educate. So if you have that issue, you can't be selective yourself. You can't say, I only want to teach here, I only want to do this job, I only want to teach at this level. You can't do that because you just can't do that. You can't say, oh, I only want to teach online. Well, if you never taught in face-to-face, they're not going to hardly hire you. Okay, if you've never taught at all, number one, you've never taught face-to-face, number two, you've never designed a shell for your course, number three, you've never stepped foot in a classroom, this is your first education job, they're not going to have you teach online. They're just not going to have you do that. Typically, especially at a doctoral level. Like if you're going to teach a doctoral level class, they're not going to have you do that. They want someone, like for me, because of COVID, I now know how to teach online because we've had to go to that format. We actually teach hybrid right now, but we teach a lot. I know about Zoom. I can set my shell. I know how to do all that now because I've had to learn how to do that due to COVID. However, before this, I didn't know how to do that. So my plan was to teach for 1 year on ground before COVID happened. And then with that experience, then go learn how to do online teaching because I want to get a job this summer coming up teaching exclusively online. So I can go travel, do whatever I want to do, log on, grade some papers, whatever I need to do, and still be in the Bahamas or wherever I'm at traveling. Again, prior to COVID, but neither here nor there. So you have to be mindful that if sometimes it's better to take what I call the backdoor approach to things. If they won't hire you to teach at the baccalaureate level, but the LPN program is going to hire you, go there and get your year or two experience. Learn how to teach there first. And then once you learn how to teach there, now you can say, I have experience with the LPNs and I can figure out how to apply it to the baccalaureate level. That's what I actually went backwards. I started at the baccalaureate level and I said, you know what? I want to teach LPNs. I want to be able to teach them from that part all the way up. And so when I went for my interview for my LPN interview, she said, have you ever taught LPNs? No, I haven't, but I know how to, I don't want to say dumb things down, but to break it all the way down to an LPN where they understand it. And that required me to know their scope of practice. I had to know the LPN scope of practice. I had to know the RN scope of practice. I had to know the difference so I know what to teach them to make sure that it was correct. So with that being said, I have no problem going somewhere to go get experience and then move on when it's time for me to move on. Don't be afraid to do that. There's so many people out here who just say, oh, I want to just do this only. Okay, sometimes they're not going to hire you like that. You need to go where you can get your experience. After you get your experience, then you move on to what you want to move on to because you're coming to, you bring something to the table. A lot of times in academia, you are thrown in. And I will say thrown in because I was thrown in this semester. And it was not pretty and it was not easy. So to be thrown into a situation is not great when you have no experience. They don't really have I have a mentor, but keep in mind my mentor is working as well. This is not where, when you're teaching for the first time, it's not where like you are when you go to the floor as a nurse. when you go to the floor as a nurse, you have your preceptor and you get to shadow your preceptor for a while. You watch him or her do a few things, and then as time goes on, you take your first patient. Then as time goes on, you learn to take your second patient. You take your so forth. You ease your way into it. In academia, it doesn't work that way. They're like, here's the first day of class. Here's your syllabus. Tweak it the way you want it. Here's your class. Good luck. And again, even with my mentor helping me, there are still a lot of things that have to be worked out. So if it wasn't for the fact that I already knew how to teach, I knew how to do things, I would have been completely overwhelmed. I was completely overwhelmed anyway. I would have been even more so completely overwhelmed if I hadn't had that experience. So I don't recommend you coming into education without some kind of back knowledge. So again, go do the clinical route. If you do clinicals for a while, see if you like clinicals with nursing students, see if you like educating them. Again, clinical is the hands-on. Clinical is the hands-on. You're teaching them how to be the nurse. So go do that. See if you like it. See if you like being up at 6 something in the morning or 5 in the morning trying to get the clinical, teaching them what they need to know. You still have to grade papers or grade care plans or whatever in clinical. You still have things to do that will kind of give you an idea if this is really what you want to do or not. So hopefully that answers some questions. If you have more questions, definitely comment those below. Again, we're trying to get this channel up to 2K. Get this channel to 2K. I'm going to start my live sessions where it's called In Class with Dr. Marida P. And what we will be doing is answering nursing questions. A nursing Q&A where you can ask me anything about nursing. You can ask me my personal experiences. What would I do if this, that, and the other. So we're going to start that as soon as we get to 2K subscribers. So definitely keep this up. Definitely like, comment, share the video. That's what helps gets it out there. Subscribe yourself if you haven't already. Definitely I feel like I have some pretty decent content here on this channel. For you all who don't know me, I am someone who is more research-based in my approach when I do my videos, for the most part. Again, I will say it's an opinion if it's an opinion. But for the most part, I'm not doing these videos for the kiki and the laughs and giggles and to show a glamorous time and this, that, and the other. Do I do videos like that? From time to time, yeah, I do. Do I have fun videos? Yes, I do from time to time. But you'll know when those are fun and when they're not. Most of my nursing content, though, is really based off what it's really like to be a nurse. It's not sugar-coated. I don't sugarcoat anything. I don't even coddle my students, so I'm not going to coddle you. I'm not here for the money, so don't even think that. Do I get paid? Yes, I do. But believe you me, I make more money doing the jobs that I already do. I have multiple streams of income, so this is not about money for me. This is really about getting you all prepared truly for what it's like to be a nurse. I'm definitely here for all nurses because I want you all to succeed, or all students because I want you all to succeed. And that's pretty much it. That's me in a nutshell. Definitely follow me on IG. It will be somewhere here on the screen. And until the next time, you all take care. Bye-bye.